Hello, everyone, and thank you for tuning in to IFFGD's Research Award Winner Series, Where Are They Now? This program was developed not only to acknowledge this year as being IFFGD's 30th anniversary, but to also give us a chance to reconnect with some of our past or current Research Award winners. So today we actually have the pleasure of speaking with Dr. Almario, who was our 2020 Research Award winner for clinical science investigator. So thank you so much for joining us today.
Yeah, thank you for having me. Appreciate it.
Yeah, can you tell us a little bit about yourself and maybe where you're currently located, as well as some of your current research focus?
Sure. Yeah. So again, I'm Chris Almario. So I'm a gastroenterologist and health services researcher at Cedars-Sinai in Los Angeles. So obviously very honored to have been selected for the award. So thank you so much. And there's a lot of different things that our research group is working on right now. So a lot of different areas within functional GI disorders. So. One of our main focuses has been to update our understanding, better understand the prevalence of the many different functional GI disorders. So to do so, we've done a number of national surveys, have recruited tens of thousands of Americans all across the country to complete these surveys. And one of the goals is to understand how common these disorders are in the community. And I emphasize the community because we're recruiting people who obviously see the doctor or patients, but also those in the community who maybe have not seen a doctor. So just to get a sense of how common these disorders are in the community amongst all Americans. That's one area of focus. Another area of focus is that we're very into is try to figure out how patients approach decision making when it comes to their treatments for various disorders like IBS and chronic constipation. Our group has done a lot of that. And perhaps one area that we're really interested and excited about, obviously with COVID going on, it's just such a huge impact on every aspect of life. But our group and others believe that's going to have an impact, on the GI community. Many you may know that COVID can infect the GI tract, can cause GI symptoms. Obviously, all the different measures and stress related to COVID can cause a huge psychological toll. So because of those two factors, we think, after COVID is come and gone, we expect that we very well may see a large increase in the number of people who have functional GI disorders like IBS and so on. So that's something our group is going to be studying and tracking over time.
Yeah, and you've definitely touched on some of the questions that even I have, and I know the general population might have, as well as just some of the long-term effects of COVID and what that might be like for anyone who suffers from a chronic illness such as GI illnesses. So it's really cool to hear that at least your lab is investigating what that might look like for the future. So I know you've briefly touched on some of the things that you would like to understand as far as in the community and how it GI disorders affects the community. But what do you hope that some of these research studies that you are involved in might help you better understand as far as GI conditions in the adult and children population?
Yeah. One of the things I'm most interested in is healthcare seeking, really, because as I kind of mentioned earlier, in the community, some of the people with these conditions, they might be seeing a doctor regularly. They might have a good relationship with the doctor and their team, and are getting great treatment for their symptoms. At this point, unfortunately, we don't have a cure yet. But at this point, one of the goals is to manage the symptoms, try to improve quality of life as much as possible. But there's a large percentage of people out there who are suffering from these symptoms at home, and for whatever reason are not, haven't sought care, whether that's no insurance or not being aware of different effective treatments that we have, and so on. So that's something that we're really interested in. We really want to study that. See which people are seeking care, which people are not seeking care, trying to reach out to them through kind of novel means. Perhaps using social media to try to reach these people. They live on social media, but may not know or understand that, seeing the doctor could certainly help them in their day-to-day lives in managing their symptoms. So that's something that I'm really passionate about is trying to to reach people and to hopefully guide and educate them that yes, you're experiencing symptoms, that we do have ways to treat it, and let's get you hopefully convince that seeing a doctor, or at least talking to a doctor, is hopefully lead to improvement in their quality of life.
Yeah, because I mean, living with any GI disorder, especially like IBS, GERD, and gastroparesis in particular, some of those really impact the quality of life on day-to-day basis for many patients. And I mean that just goes for any of the GI disorders across the board. I mean, the symptoms and living with those symptoms day to day, it can definitely have a significant impact. And just the fact that that's what you're seeking to investigate is how can we get everyone in to seek help from a healthcare provider? I think that that's a great area of research to really focus on.
Right.
So, yeah, so basically, with some of the research too that you've also been involved in, what would you consider being your most successful one? I mean, we all know that all research is important, but what would you consider maybe being your most successful research study?
Yeah, a couple come to mind. So we completed this our group at Cedars in collaboration with Dr. Bill Che at the University of Michigan, and Dr. Brennan Spiegel, who's my primary mentor, main mentor at Cedars. So together, we helped launch what we call the National GI Survey. So we in 2015 launched a National GI Survey questionnaire about GI symptoms, just to get a sense of the burden of GI symptoms in America. So there, we recruited over 70,000 people all across the country to complete that survey. So a huge, huge, huge database. And then just earlier, actually early last year, in 2020, we launched National GI Survey 2. So there recruited almost 100,000 people.
Wow.
So it's just an amazing wealth of data that enables us to answer lots of different questions about those who are experiencing GI symptoms, those who have symptoms consistent with functional GI disorders like IBS, chronic constipation, and so on. So yeah, as part of that survey, again, a wealth of data on their symptoms. We asked them about their healthcare seeking, if at all. We asked them why they didn't seek care. We asked them about what medications they're using, their satisfaction with such medications, or dissatisfaction with medications. So, really enable us to get a really deep look in terms of, what people are experiencing out there in the community, and gaps that we can try to address as best as possible.
Yeah, and I mean, it really sounds like you guys have definitely captured a great variety of the patient population and just really taken the time to understand the needs within the community. And I think that that is very hopeful and very inspiring to hear that there's doctors out there. I mean, with Brendan Spiegel, we've talked with him recently, and just knowing that that is your mentor, and then Bill Che, knowing that there's mentors out there who have been heavily involved in research and how they are influencing the younger investigators to further research, even in the future. I think that's so cool. And just to hear your story about some of those studies that you guys are taking part in.
Exactly. Yeah, that's one thing I'll echo too. I certainly wouldn't be where I am today without the mentorship from both Dr. Spiegel and Dr. Che. So, they've been such a important part of my, career development, and yeah, I'm just grateful for all they've taught me.
So cool to hear that connection for sure. So, I know like you've won the 2020 IFFGD Research Award. So, can you tell us a little bit about how that may impact your career in research? And then also, what other acknowledgments might have you received for the research that you are doing?
Yeah, yeah, no, again, it was just an incredible honor. I was very excited, and to be frank, surprised. So it was just very happy when I received the notification. It was kind of like a nice affirmation that, all the work that I've done thus far, trying to, better understand and improve the lives of patients with functional GI disorders. It was, just a nice affirmation, and, hopefully I'm on the right track, and that, hopefully ultimately can impact patients' lives in a positive way. So yeah, obviously that was a fantastic honor. And since then I've been very fortunate to have some other honors as well. So Recently was invited to be part of the American College of Gastro Research Committee. So obviously I'm very invested in research, and was actually in 2015 was a ACG Junior Faculty Development Awardee. So it was a great opportunity to kind of give back, so to speak, and be a part of the team that reviews and ultimately awards grants, and hopefully supporting people like how I was supported. Most recently, was very excited to be invited to participate in this upcoming ACG and AGA Chronic Constipation Guideline Committee. Very excited about that. I look to guidelines, for guidance on how to manage certain things. So to be part of the committee to come up with the guidelines for, how to manage chronic constipation, which is obviously very common, seen in obviously in GI, but primary care in every other area of medicine. So to be a part of that joint guideline committee was an immense honor. And then, another big event. So it was also awarded from the NIH a Career Development Award. Actually focused on colon cancer screening, but beyond that, focused on how improving patient and physician communication. So, obviously, colon cancer screening is an important public health issue. But what I learned here, I'm hoping to apply to in the future to functional GI disorders. So coming up with ways to enhance, the communication between patient and doctor with respect to their functional GI disorders. So, yeah.
I mean, those are significant awards and acknowledgments for sure. And just to hear about all of those things, congratulations to you as well, because we know it takes years and hard work for all of the research that you guys are involved in. So, and congratulations definitely is extended to you at this time for that. And then also, I know you've talked a little bit here just about how you're heavily involved in what's really the first step of understanding these GI conditions is really understanding the patient population and their needs and how physicians can best meet the needs of the patient community. But what do you specifically enjoy about being a researcher and why?
Yeah, lots of things to be honest. It's actually something I didn't think about when I applied to med school. And then, just meeting many people along the way, a lot of mentors, many of whom were physician, scientists, clinician, investigators, and just kind of seeing their kind of day to day, eventually kind of drove me to want to seek that path. And I think the thing that I really like most about it is that we can if there we can study certain areas of medicine that we're passionate about. I'm passionate about many different things, but clinically and research wise, a lot of what I do and see and most interested in studying and trying to improve is just how we can interact and hopefully improve the lives of patients with functional GI disorders. So being a researcher and having the opportunity to decide what I want to study and the aspect of that I want to study and the kind of gap that I want to fill, so to speak, having the ability to kind of to choose what I want to look at, I think is very interesting. Other things that I come to love, working with a team. So we have a very large team at Cedars, a lot of research coordinators, biostatisticians, and so on. So working with a team, all focused on the same goal, I think is fun. I've obviously had fantastic mentors, still have fantastic mentors who are still teaching and mentoring me today, but I also love mentoring too. So that's something I've come to realize. So, I work with a lot of junior investigators, fellows, residents on various research projects. So the opportunity to work with them, to teach them, and it's very gratifying to see them get an abstract accepted, a paper accepted, and and helping them with their goals, I think is great. And then the other thing I would say too is, I'm still a practicing clinician. I still love, interacting with patients. That one-to-one interaction, I think, certainly can't be replaced. But with research, can potentially impact, patient care on a larger scale. So beyond that, kind of, one-to-one interaction. So, I think it's exciting to know that potentially, the research that our group is doing could impact, patients, across the country, across the world, in many different ways. So, yeah.
Yeah, thank you so much for bringing in that aspect and helping us understand the aspect of research and how it impacts the patient care for sure. And speaking of gap needs, I know you mentioned it briefly about how you hope that your research studies can fulfill those gap needs, but what do you see as being some of the current gap needs in research for GI disorders? And how do you foresee some of the research studies coming from your lab to really fill some of those gap needs?
Yeah, yeah. So, one thing that, as I mentioned earlier, very interested in healthcare seeking, trying to, to get people who certainly could benefit from, interacting with a doctor, and I think that's something that I'm very interested in. But then once they're at the doctor clinic, at that point, I think that we still have a lot of room for improvement as well. So one of my, I think one gap that our lab is very interested in is how do we improve patient communication between the doctor and the patient, and how do we, can we develop tools that help kind of improve, that decision making, so that it's between the two. So just kind of an example. So, IBS, very, very common condition. And, there's many different treatments, and they're all very, very different. So, of course, we have neuromodulators. There's even antibiotics that can be used. A diet can be used, and psychotherapy. So and those are all very, very different treatments. And as a clinician, trying to describe all the different options that a patient could potentially choose from, that takes a lot of time. And unfortunately, we don't have a ton of time in the clinic. We have generally 15, 30 minutes, scheduled. As much as I would love to spend more time with each patient, sometimes it's just not possible. So, one thing that I'm very interested in is, can we develop tools that can help with that communication process? And, can we develop a decision aid that, will hopefully that can, teach patients about all these different options? And then can that decision aid then help me in a way that, try to tease out what's important to a patient with respect to, deciding between all these different, options. And then, hopefully at the end of the day, that tool can help me and the patient, together. Hopefully we can come together and come up with a decision, decide on a treatment that actually matches what the patient is looking for. And then that allows me more time to be able to provide some education and counseling and say, hey, okay, it looks like you're interested in X. I think these are things we need to consider. These are things that we'll need to look out for. These are, this is what is expected if we try this route. So I think, trying to, enhance communication back and forth, but also to make the clinic visit when we're there face to face more meaningful.
Yeah, yeah. And I'm seeing across the board that that is very common as far as what many researchers hope to fulfill in this gap need is just bridging the gap between communication of patient and healthcare provider, which sounds like it's very important to you guys as well as the patient community. So just I'm excited to really see what's to come in the future, to really help and like you said, make those minutes and those 30 minutes, like you said, which is a crazy window, make those minutes with your healthcare provider really more meaningful and impactful so that maybe the patient leaves with a better plan and strategy to manage and deal with the day-to-day symptoms of their GI disorder.
For sure.
Yeah.
Exactly.
Yeah, it's so cool to hear about all the things that are coming from you and the research lab that you are currently involved in. So I just want to say thank you so much for sharing your journey through research with us. And also thank you everyone who has tuned in to the IFFGD Research Award Winner Series. Where are they now? We are so grateful to all of our researchers and especially you, Dr. Almario, for joining us today and for providing us with that information.
No problem. Thank you. And I especially want to thank the IFFGD for the incredible award and for all the support. Thank you so much.
Thank you.